Hey everyone, welcome back to another episode of Autism Uprooted. As you saw, we have Alexandra still here, and I'm still here. We are going into part two, and this episode, or I should say today's episode, because it will be aired, separately. We will be discussing the rapid strep, often misdiagnosis of a strep infection that leads to a pans pandas flare in our children, and why rapid strep can be false negative, and how do you go about that. Alexandra will be speaking to us from a mom's perspective. So let's go ahead and proceed with today's discussion on rapid strep testing and pans.
Welcome to the BioNexus Health podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie A. Dashore.
Hello again. So I'm going to be speaking about my experience, and this experience is not in regards to neurodiverse child. I'm speaking about my neurotypical child that has gone from 0 to minus 100 within a couple of weeks, and we didn't know what is going on. So now we've got a history within the family, bearing in mind Philip has got pans pandas, and we know all the symptoms, we know how it's manifested, we know what's going on. We have seen Patrick deteriorating slowly but surely over the time. Philip had Epstein-Barr virus because it was going around somewhere in end of May, June, and then the whole school got it, didn't got Patrick, but the minute it got it, it set his brain on fire. That was the beginning of it. And then he just woke up one night. He came to me, I was in the office working, and he was telling me, "Mommy, I feel like my body is on fire. I feel like I'm burning." I have seen him a bit red, but I was like, "I don't think you've got fever." And when I touched him, he was boiling hot. I took his temperature and it was 42. He was fully aware of what's going on, but he was having fever 42. Straight away, I have given him some antithermic just to calm his fever, because it was 42. It wasn't anything that I would have been calm and settled about it. And he was complaining about a big headache. I have calmed him down. The fever has been gone by the morning. But from that morning, he was just coughing a little bit, just showing a little bit of sore throat. And then on his body, he started to have like a big rash all over his body. 3 days after, his rashes was coming and going, coming and going. 3 days after, I'm finding myself feeling the same somehow flu symptoms, like sore throat.
Oh, you now, this is you.
This is me 3 days after. I'm starting having a rush from my legs up to my tummy. And I was like, what's going on? I'm going to work and I can't feel my hands and my feet anymore. So I'm unable to work. I'm not unable to walk. And I'm going in the hospital. And they keep me in the hospital for 3 days and telling me that you've got autoimmune arthritis from streptococcus. And I was like, okay. At this point, Patrick's symptoms were just rashes. He was hyper, but nothing else yet. So I'm being in the hospital, put on anti-inflammatory products, like like very strong products, because I couldn't walk anymore. I'm coming back from the hospital, just trying to get myself together, although I was in pain and not feeling well. And my child starts to showing behaviors that haven't been there before. Obsessive compulsive disorder, vocal tics, stimming, He was keep repeating words that they shouldn't, aggressive behavior. We didn't have that before with Patrick. Patrick was the best child. He was always understanding us whenever we were dealing with Philip. He was there for Philip. He was there for us. But when the time came for him to, I don't know, not feel well anymore, it was so severe. We couldn't control him anymore. He was uncontrollable. He was screaming, shouting. And then he would have had like a couple of minutes when he was like, I don't want to be like this. I don't know what's going on with me, mommy. I literally can't control myself. And I was like, this is Pans Pandas. This is Pans Pandas. We are running in Romania. And we started to do all of his testing. I have spoke to you and told you, look, this is what's happening. And we have done the test. We've done the exudate, the nasal swab. Nothing, it wasn't showing anything, but I have done all the testing, the blood test for autoimmunity, for antibodies, everything. And there was a completely different story, together with an EEG that was showing encephalitis lines on the EEG.
On the EEG.
Yes, his EEG was so scary for the doctors. And here I had the surprise of my life when I've been to Romania, and I was telling, I have seen 3 neurologists and 1 psychiatrist, all 3 of them, although I was expecting for him to get like, oh, this child is autistic, or I was expecting, you know, like a diagnosis. I have told them how everything happened, and going again to fever and then a rash that didn't calm down. They were like, no, this is encephalitis. This is encephalitis. So these child definitely need to be investigated more. We need to do more tests for him. This could be Lyme disease. And I was like, what's going on with these doctors? Why am I being so lucky? And I have seen 3 different neurologists that were going on the same path with you, you know, and it's been like very nice to see that other people are going in this direction as well. So we've done the testing and we've started the antibiotic, and within 1 day, my child, together with our protocol that we were following, but because he was so severe, we needed the antibiotics just
yes, of course,
down, and especially because of the infections that we had found out in his blood test. So we have started that, and he just within 1 day, he started to be a completely different child and back to basics as he is now. As we are speaking now, both of my kids are by themselves downstairs just doing activities for school.
Yes, yes. I'm so glad, you know, Patrick is better, right? The reason why this is being discussed under Autism Uprooted podcast series is because, you know, Patrick is completely neurotypical, unlike his brother, who is neurodiverse. But this applies to all of children on the spectrum that have PANS. It applies to all children with PANS pandas.
Yes. And what I want to emphasize is that the symptoms that he was showing at that point, everybody would have, if they wouldn't have known the background, if I would have gone there and said, this is what my child does, has these tics, has these OCDs, he would have got a diagnosis of ADHD for sure, and probably autism. But because the explanation started with a fever and the actual symptoms of flu, they couldn't go onto this path. But the symptoms, everybody that have met an autistic child, especially an older one and verbal one, they would have said he is autistic and ADHD for sure.
Yes, no, I understand. Yes, I have had one 14, she was 13 then, that she was diagnosed at the age of 13 as being autistic. Like, hello, you know, you have this brilliant young lady who just completely sort of, you know, disappeared because of PANS pandas flare up, which her mom did not know. And mom actually did a podcast. You know, mom is from the Philippines, and she moved here to the US to help her daughter. and she has done a podcast with me. So yes, and then I've had another child at the age of 6 was diagnosed on the spectrum again because he was going through a PANS flare. Now, you were lucky, Alexandra, that Patrick had a fever, a really high fever, right? Now, Patrick has been on the BioNexus protocol,
Yes,
so the immune system has improved.
this is what I wanted to say now. We were already on a protocol, but it was just how should I call it? Just a protocol for him to be safe because we knew
Right.
that some of the infection. So we were treating Patrick just to protect Philip, if that makes sense, because
Yes,
Philip was picking up things from the school and also from Patrick. And because Patrick was having them and giving them to Philip, we decided to treat Patrick. If we wouldn't have had the treatment for Patrick, I wonder what would have happened to this child, because the activity into his brain, even on the protocol, from the exposure to the virus has been tremendous. And I'm
yes.
just literally so grateful that he was on the protocol just to lower the impact that this virus had on him.
That is correct. Yes. I've had many children that come to me when they get such a virus, they end up with not being able to use their arms and legs. And you had a similar experience with this virus, right? You were not able to use your hands and
Me as an adult, I was
as an
reacting
adult,
to this
right?
virus. As an adult, I wasn't able to walk or to do my job. So I was literally holding my mouse within a meeting, and I have realized I can't move my hand. So if for me it was that strong, imagine what have been into his body as a child. And that's why I'm so thankful that we have been on the protocol, because otherwise I don't know what would have happened.
That
And
is, yes, yes.
again, Philip has
Yeah.
only had some mild cold symptoms because he was already for 2 years on the protocol. So his immunity was so established that this virus didn't have any impact on him.
Yes. And now, now hopefully, but Patrick's immunity has improved as well, because usually when someone ends up with such a huge PANS flare, many times there is no fever. In fact, pandas is the alternate fever response where you go into this massive antibody production, autoimmunity, right? And yes, if you take your child more often than not, the child will end up with a psychiatrist with psych meds for ADHD, for OCD. Oftentimes they are medication that is used for psychotic people. And yes, and pandas is not widely known. It is becoming widely known, which is great. I mean, the
Yeah,
research
I've been
started
happy.
what, like 25 years ago? So isn't it enough time that modern medicine caught up? So I'm glad in many countries the awareness is there now.
Yeah,
So that's good.
they didn't dismiss what I was saying. So I was very happy that at least they got the information, not for me necessarily, but for other parents that are dealing with the situation. So,
Right, right,
yes,
exactly.
this was the experience with Patrick. Now, thanks God, everything is back to normal. His grades have improved so much, everything, his writing skills, everything, all the symptoms from pandas, imagine them 100 times higher and then going back to normal.
Coming back down because you
And
were able to get
yes, and again,
the
what I
right
want
thing.
to emphasize is like,
Yes.
this is autoimmune disease. Even if we were on a protocol, kids still get the viruses. So parents shouldn't expect that they will never ever get sick. No, you just expect them to deal with the virus better than the other kids, or you just expect them to deal with the virus, but the autoimmunity stays there with us.
Yes. There is no cure from autoimmunity. The only thing is to regulate your immune system. So you can choose, steroids, biologicals like Humira, or you can choose IVIG forever, or antibiotics, every day forever, or you can choose all natural herbal medicine. But it is important to be on a maintenance protocol. That's the key, so don't say that, I'm exploring this herbal treatment for pandas, and once the treatment is done, then we are home free and then that's it. But that's not how it works. It's autoimmune. So that is something that's an important point you mentioned. So right. So, I would just like to summarize in case it was unclear, because, we are both very passionate mothers. When we get into it, we really get into it, right? So just to summarize, right? Patrick had been exposed to Epstein-Barr, and then this time, so interesting that when Patrick got sick and he developed, these massive pans flare symptoms, when you took him for a throat swab, a nasal swab, a throat culture, because he did have mild sore throat, all of those were negative. And understand this, yeah, they were negative. And yeah. And for children with pandas, especially the ones that end up with such a massive flare and that have had viral exposure, like heavy duty viral exposure prior, you will find that the throat swab, nasal swab, throat culture can all be false negative. So, and then the symptoms kept escalating. That is when Alexandra, you got in touch with me in trying to problem solve, like what is happening, because it's interesting that and I don't blame any moms, because this is what we know. We experience our child experiences sore throat. We go to the pediatrician, and usually the only thing that is done to establish the strep is the throat swab. And in fact, if you request a culture, they just look at you weird. Really? Like, the swab is negative. Hello. So then you go, no, you want to do a culture just to be double sure. But that came back negative as well.
Everything happened in the UK. So we took him to the doctor straight away with the rashes and all that. And they say, I think it's a heat rash. It was July and we were still having the heat on. So
Oh, God.
they've done the nasal swab. They've done
Right.
the nasal swab. And then the results came like 2 days after and they were negative. And I was like, no, this is PANS. So we went in Romania, and in Romania, I had repeated everything. Nasal swab, which again was negative,
Negative.
but the bloods were showing positives.
Yes, exactly. So this was at the same time, you have a child going through this obvious PANS symptoms. And, here's the thing. Oftentimes, and you make another important point, Alexandra, that it was July. So yes, the strep rash, the impetigo strep rash can be mistaken for a heat rash, unless it's oozing with pus and all that. But the beginning impetigo can be mistaken as the heat rash, which it was mistaken for in Patrick's case. And then in July, nobody really looks at strep and sore throat. Unfortunately, with the global climate change, all kinds of issues are happening at all times of the year. It's not like a winter season problem that you end up with cough, cold, strep, etc. So that was another kind of, skepticism, which can be demonstrated by primary care doctors sometimes. Maybe they're genuinely not aware, right? And they look at you like you have two heads. So, right. So in Romania, the same time when you had the swabs negative, now we discussed and I explained to you that you need to do the, ASO, or ASLO testing in some countries it's known as. So ASO and anti-DNase B antibodies, strep antibodies have to be tested. Additionally, always test for Mycoplasma pneumoniae, IgG and IgM, because these can go closely, right? Mycoplasma can come as a opportunistic infection once the body is so severely compromised, like Patrick's body was. I mean, it went into, well, that's what PANS is, right? It's autoimmune encephalitis. Now, for you, Alexandra, it went into autoimmune arthritis because
Yes.
you're an adult and, it can take that course.
Different. And if
Right.
probably would have been Philip, usually for Philip, strep would have give him arthritis and he was unable to walk. But for Patrick, it's different.
Right. For Patrick, it went into a different mechanism of manifestation. Correct. Yes. So let's have a look at the labs so that, we
I'll just show
understand.
the labs. Should I start with the EEG so you can see how messed up it is? But then I'll go into the blood test and to the nasal swab, and you're going to make the comments on it because you're the experts on the lab test.
Yes.
Yes?
Go ahead. Yes.
Okay, let me share the screen now.
Is there an EEG report that you can share?
Yes, so basically we had the EEG report for this one, but I
Oh,
don't.
my goodness. Oh, the poor kid. Right.
This is what was going on. And
Right.
he would have looked normal, like he wouldn't have had any.
Oh, my goodness. Right.
He was still responsive. He was okay, but his brain would have been showing this.
Well, his brain was on fire.
Yes, exactly. I don't have the report because then a week after we had to repeat the test and it went normal. But this
Okay.
was after we started the treatment. So now I'm gonna share the nasal swab and the throat swab. Can you see it?
Yes.
So
So
basically,
this is the culture.
yes, the culture, and it's showing growth.
Absent. Exactly.
Everything is absent.
Right. Gabus, which is your trigger for PANS, is absent. So yes. So strep is showing up as absent. Interesting. Right. I mean, I'm not surprised. I've seen hundreds of these, if not more. Right.
And now let me show you the ASLO. Which is this one.
Yes. So the strep blood test was high, very clearly high.
And just to make it sure, here at this point, we would have already started the treatment, the aggressive treatment with the antibiotics because we couldn't live with him anymore. His aggressivity went to the top. So these high values are on the beginning of the treatment.
Right.
Which are, I don't want to imagine what would have been there when he was like at his
peak
of his crisis.
Right.
Yes. So
I
this
understand. Yes. And vitamin D goes low as well. That's true.
Yeah, and it was full summer in here, and we were in Romania at 40 degrees.
Yes.
And then we've got again antibodies from Epstein-Barr still present and very high.
Yes.
And then we've got the anti-DNase B, which was surprise.
That was also high. Correct. Yes. So there you go. So these are the markers, the blood work that needs to be done. And for those of you watching, you can see that these tests were done right one after the other. So we know it is within the same time period.
The same time. So everything is being collected in the same time at the same hour.
Right. So this is for people who are not aware, the mind is going to be blown because I consistently say that for a PANS child, you cannot diagnose or cannot assume that just because the culture and the swab, the throat swab and throat culture is negative, you just cannot calmly just say, oh, he didn't have strep. Alexandra, I cannot tell you how many moms, you know,
Should I stop the share?
just kind of, what's that? Sorry.
Should I stop sharing?
Yes, you can go ahead. Yes, yeah. Thank you for sharing. Yes. Yes. So many moms just, go to the pediatrician and you can't blame the moms because that's what they are informed. That no, there's no strep, we did the swab, we also did the culture for you. It's like, okay, now you're being a troublemaker, now go away. Your child doesn't have strep. Uh, Another important point that Alexandra mentioned was, using antibiotics. But yes, of course, um, I'm not against antibiotics at all. I mean, it is modern medicine is very important to take advantage of when the situation is extreme, when it calls for it, when we want rapid results, somebody is suffering by all means, right?
Exactly. If you remember, it wasn't my stress, it was him, like literally crying because he couldn't control himself anymore. As you remember, we had our conversation at that time, and I was telling you, he's desperate, he can't deal with it anymore, he doesn't have any control. And the decision has been made together. We are not using antibiotics. We have always been onto the natural protocol since we have started with the biomedical intervention, but it was so severe and it was showing such a strong symptoms that we definitely needed to calm him down. And it was just until we got things under control, and now we are not giving him antibiotics anymore. He's back on the protocol, and he's
Yes.
always on the protocol, but he just had the addition of the antibiotics to get him calm faster.
Yes, he was. He was in a extreme, situation, and he's an older kid as well, right? Now, last week, those of you who watched the podcast, we spoke about one child in New Jersey here, and mom was discussing Harmon, and Harmon had severe, not as severe as Patrick's, but half as severe as Patrick's, if I may say so, and uh, mom absolutely did not want to do anything conventional. One same story, right? Her throat swab culture all came back negative at the GP's office, pediatrician's office. And she and I discussed, and what we did was we increased his herbal protocol, like I have it for all the children in my practice, that when you do get cough, cold, flu, strep, etc., so throat, you need to go to 4 times a day. So that is what we did. She followed that for Harmon, and that is what brought him. We massively increased his anti-inflammatories. I think we also gave him ibuprofen at an anti-inflammatory dosage for 2 days. That was it. So when you're doing herbals, and interestingly enough, uh, doing the anti-inflammatories in such a heavy duty flare, because every child is different, Harmon actually developed gut issues from that. So after 2 days, we were going to stop anyways, but I think we had to stop after a day and a half of using ibuprofen for him because, he started having like dark stools and pain in the gut, even though it was being done correctly. We were supporting the gut. The gut support was in place, probiotics were in place, it was being done after food, but some children on the spectrum just have such compromised guts that even NSAIDs are not, they don't go. It worked. It helped overall, along with the increase in his herbals, going up to 4 times. So mom said, I'll do the herbals 5 times a day, but I don't want to do ibuprofen anymore. And we did that. And within a week or so, he calmed back down. from being aggressive and OCD and was really sharp. I mean, it's hard to see. It's so hard to watch that.
Patrick's symptoms were so high, and he
Yes.
was dealing with them for a while until we got the test results and all that. So our only chance at that point, like when we've been and seen the other doctors, everybody was like, no, this child needs to get into the hospital for IVIG. And I said, no, thank you, you need to wait. I'll rather do the antibiotics, but and he's gonna be fine, I'm sure. So yeah.
Yes. And again, in a serious situation, whatever, IVIG is fine. I remember trying one high-dose IVIG for Brian, and he got strep in the bang in the middle of summer as well. I remember it was extreme, right in the middle of summer camp is where he got infected from another child. And we did one IVIG. It wasn't for Brian, completely utter disaster. And but then for some children, it helps. So whatever needs to be done, if nothing else is working,
No, but for us it was okay as it was. So
the antibiotics were working. Good.
yeah, so
Right.
it didn't do any harm to him 1 week, and
Right.
that's it.
Now, it is best to avoid invasive procedures. It's just, it is a blood product from many, many, many hundreds of donors, and you never know. You never know, what it has been screened for. I know that, screening for COVID is not yet available, if I'm not mistaken. So there are other things, right? Babesia, Bartonella is not screened for. So
Yeah, we'd rather not. I prefer the antibiotics.
if it is life or death, then of course whatever is
But
needed.
I had to give it a try. As you know, as I have started with the natural protocol, I could have gone and done stem cells, straight away. And I said, no, I'm going to give a chance to the natural protocols. If it's going to work, it's going to work. If not, I'm going to go step by step into the protocols. So for me, it worked with the antibiotic. I don't need to think of the IVIGs. It worked like that, but I'm going back to my protocols now, and they're working fine. And again, what we have done as a family, I have minimized his exposure because
Correct.
it's winter. They are going into school, and in school they are meeting tens of kids with different viruses, with different exposures. So it wasn't a point for me to keep them into that environment. That's why we have changed, and now we are doing the online school, because I need to protect them. They are at that point where I get to choose what am I exposing them to, what viruses, social circles, and whatsoever. I don't want them to suffer from the exposure to the other kids that are coming with fever, with viruses. No, that's not for us. And it's working amazingly. I don't know if we're going to do it forever like this, but for this moment, this was the best for my kids, especially that Patrick now is in the recovery period.
Right. No, that does make sense. Absolutely. So, once again, this was an important and a serious podcast because, you understand that there is a lot of responsibility on us as mothers and fathers of children, even if they are neurotypical, when they have this kind of a breakdown, right? To do due diligence, do the research. I know it is exhausting to watch your child, and when you go into your GP's office and the labs are looking, different than what you would have expected. Do your research. It is important before you start any kind of heavy duty psychiatric medication. I mean, do you really think that your child is psychotic? Uh, Many times parents just want a quick fix to help their child. And sometimes that is okay to do, but then it is always important to dig deeper and see what is missing. You cannot be doing antipsychotics for weeks and months. There has to be another way of handling things. It's just a little child. I don't know, growing up, you don't hear 6, 7, 8, 9-year-olds, having schizophrenia. Like what? Like childhood dissociative disorder. Like, okay, please, the underlying issues have to be looked at. So once again, thank you, Alexandra, for this robust discussion today that we had. It'll be very informative. And for those watching, thank you for joining us. And I'll see you at the next episode of the BioNexus Health Podcast. Be well and take good care. Namaste.
Thank you for joining Master Herbalist Dr. Jody A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.